What we see anecdotally is that we have a very advanced HIV epidemic among trans women. So for many years, trans women we've known have been disproportionately affected by HIV. And at the same time, there's been a lot of calls for gender-affirming services as a way to mitigate HIV risk among trans populations, specifically among trans women. And we've also had a lot of trans-specific care services, gender-affirming services, and surgeries now in the city, and we've not seen a plummeting of the HIV prevalence, and in fact, we still have a significantly high HIV incidence in San Francisco. At the time we started this study, we were pretty sure that this steady HIV prevalence we were observing was really just people who had acquired HIV a long time ago and were continuing to live with it, and we didn't think we would see really any seroconversions, that it would be very low because there's a whole host of prevention and care services specifically focused on the trans women community in San Francisco. There are HIV testing efforts. There's all the most novel HIV prevention efforts and care efforts in San Francisco are happening. There's PrEP implementation, there's treatment as prevention, there's rapid starts, there's same-day starts for PrEP. So we thought, given this whole panoply of services that are being rolled out for all communities and specifically focused on trans women, plus the gender-affirming care services, that we wouldn't see new cases, and we did. So we saw a pretty high incidence, and it was 3 times as high among young people, 18 to 24, which speaks to kind of a new epidemic of HIV emerging among young trans women. And all of the people who seroconverted over the course of the study were trans women of color, which is really alarming. We know there are huge disparities in HIV among trans women, but this really absolutely puts it at the forefront of what we need to do is understand that. So we could slice and dice the data a million different ways, but sometimes it's so important just to get it straight from community perspective. So one of our last questions on the survey is, what would you change for trans women in the Bay Area, especially as it relates to HIV risk? And across the board, the biggest issues were people wanted to have a reduction in stigma and violence. People wanted acceptance in community. People wanted prison and justice reform. People wanted these big, meaty structural issues like educational opportunities, job opportunities, safety, violence reduction. And medical services were in that gamut of issues that they wanted, but they were just one small sliver of a very big picture of needs that people in the community identified. And in reality, the whole system has to work for people. You can't be healthy or prioritize your HIV prevention when you don't have somewhere to sleep. So I think we need those gender-affirming services. We need the HIV prevention care services we have, but until people are able to be alive and healthy and not face violence in their everyday experience, then we can't really expect much of people. That it's an unfair expectation to think that when they are food insecure, they can take a daily pill every day or think about their HIV prevention needs. So we have to think of what is the pyramid of priorities for people, and we have to meet those needs.